Hello you guys, welcome back to my channel. I'm Tiana, and in today's video we are going to just be continuing along my brain surgery journey slash like update series. So here I am today, 6 months post-op. Yesterday was August 17th, and that was the exact 6-month post-op day. On February 17th, 2022, I had transsphenoidal brain surgery to remove a benign pituitary tumor. It was a micro, it was like almost a macro adenoma, but it was like really tiny. And yeah, it was just a pituitary tumor, and it kind of like grew into my sinus cavity. So I was getting really bad pressure buildup, headaches, and it also was like interfering with my hormones. So now that I am 6 months post-op, I can give you a very comprehensive update on how everything has been going. I know I filmed a 3-month post-op video, and in that video I was very sick. Basically I had developed a complication, and the complication was hormonal migraines, which my neurologist said is something that's quite common that can happen to a lot of people who have brain surgery. They will develop migraines. So basically I developed migraines, and most of the preventative medication that I was using for my pressure related headaches had stopped working, because now instead of having pressure headaches, I was having migraines. So 3 months post-op is about where I developed that. I got very sick, didn't know what to do, was trying a bunch of different stuff like steroids, carbamazepine, and just like it was really trial and error of figuring out what medication was going to work for me. So basically what happened after 3 months post-op was that I was put on carbamazepine, and about a month into taking that medication I got so sick from it. So some people basically, when they take carbamazepine or similar drugs in that class, they will develop DRESS syndrome. I think it's just called DRESS. It's like basically my body broke out in hives. I was covered in hives all over my entire body, and my liver levels were elevated. Basically that medication caused a severe allergic reaction. I remember, I think it was, I want to say like the end of May, early June, I had to be hospitalized for 2 days because I had that. I was covered in hives. I had a fever of 103.4. And yeah, I was basically rushed to the ER by my parents, and then from one ER I had to take an ambulance and go to a different one that had dermatologists, and I was abruptly taken off of carbamazepine, and my rash was like there still for a couple weeks basically. But when you have DRESS, you get a topical steroid. I was also on prednisone and hydroxyzine, which is basically like Benadryl. But since I was taken off of carbamazepine so suddenly, I started having literally the worst migraines of my life because I wasn't on any preventative medication. I abruptly stopped taking an anticonvulsant, so I was having excruciating migraines, and I had to use injectable sumatriptan to stop them. And then I was basically at that point just continuously injecting myself with sumatriptan. I was really bad, and that went on for about maybe a week, and I had to go to the ER for my migraines because they were so bad. It was legitimately the worst pain. It felt like shooting, stabbing pains on the right side of my head, and it was debilitating. Whenever I would get a migraine, I would basically just be crying and screaming in pain. My parents were scared. I was scared. I didn't know what to do. So I had to go and see my neurologist again for an emergency appointment, and at that point he prescribed amitriptyline for my migraines, because basically I had tried topiramate, I had tried Nurtec and Amivig, and I had tried propranolol, which is a beta blocker. So basically I had tried every single migraine medication that was out there, and I was allergic to carbamazepine, which was the one that had been working for me, but obviously I couldn't take it anymore. So he prescribed me amitriptyline at a low dosage, and amitriptyline is it's an older class of tricyclic antidepressants. So he told me to take 25 milligrams for a week, and then the next week bump up to 50 milligrams, and then continue taking 50 milligrams from then on to the near or late future. I don't know. I'm taking it right now still, and it has honestly been working so well for me. So if you also struggle with migraines and nothing has worked that you've tried, possibly try asking your doctor about amitriptyline. It works really, really well for me, but the first maybe month or two of taking it, I was exhausted all the time because you take it at night and I would wake up the next day and just still be so tired, but really it's just your body adjusting to a new medication. It did make me gain a bit of weight, between probably 5 to 10 pounds. I don't know why that is, but my doctor said, like, yeah, that is a common side effect. But since I am feeling better, even though I have gained weight, I can still go to the gym and go running and do a bunch of things to try and like combat that. But he said basically the longer that you're on it, your body's gonna adapt, and then you're not gonna like take it and continue gaining weight. You basically just take it, gain weight, and then your body will kind of like adapt and change to the new medication. And in addition to amitriptyline, I also take birth control just to regulate my hormones. So basically my gynecologist said that I have to be on a combination oral contraceptive that has the same hormone dosage every day throughout the month. And then she said, don't take the row of period pills, just throw those away and then start your next pack immediately. So yeah, birth control and amitriptyline have been what is helping my migraines, and honestly, I feel pretty much back to normal. Now and again, I'll get like a small migraine and take like Fioricet, which is basically Excedrin, and then my migraine will pretty much go away. So I'm honestly doing so much better. Just because I don't necessarily want to be on an antidepressant for my migraines for the rest of my life, my neurologist recommended Botox, and it's a really long process to get Botox approved, and it is very expensive without having your insurance cover it. But on August 26th, I'm going to be getting Botox injections for my migraines. So he said it's 32 injections, and it's like on your face and then some in the back of my head and in my neck. But I feel like at this point I'm not afraid of needles anymore. I can kind of just handle anything. When he prescribed me amitriptyline at that in-office visit, since I was having such bad migraines, he did a nerve block on me, and basically they take a needle full of, I don't know what it is, it might be lidocaine or some type of numbing agent, and they inject that into the back of your head, and it's like a pretty big needle. And honestly, I feel like injections in your head, at least for me, it doesn't hurt, because it's like the pros of that, which are stopping migraines, outweigh the cons. Because honestly, a needle like going into the back of my head is less painful than a migraine. So it kind of is what it is at this point. But yeah, on August 26th, I'll be getting Botox for migraines, and I'm definitely gonna make an update video and just explain more about that process and how it feels / works and potential side effects and stuff like that. But he said Botox takes about 3 months to be effective. Like, you get it done every 3 months, but the first cycle of Botox isn't gonna work like the next day. It's gonna take a while, and you get Botox every 3 months because it doesn't last in your body forever. So that is what is going to be happening. But honestly, I feel so much better, and I'm really thankful and blessed that I have the medication and the doctors and all of that, because I was honestly so sick. I was in so much pain, and now I'm feeling better. So I wanted to just make this video because I did really leave y'all hanging on like such a negative note because I was so sick. But honestly, it does get better if you're experiencing complications. It might not be an immediate thing. You might need to try different medications to see what works. Hopefully y'all don't have an allergic reaction and end up in the ER like I did, but I feel like that was just part of finding out what was gonna end up working for me, and I finally found it. It's amitriptyline for now, and then Botox later, hopefully. But that is it for this update video. I've been going to the endocrinologist just to monitor my hormone levels and make sure everything is going back to normal since the removal of the tumor, and she said all my hormone levels are where they're supposed to be for a woman of my age, 23. Everything has normalized itself within 6 months, and that's really good news because she said it might take as long as a year, but I'm fully healed pretty much 6 months later. So that is my update. I hope that this video was informative, and if y'all are sick right now watching this, because I know a lot of people who watch my brain surgery series are either going through brain surgery, planning to have it, or have had it. So hopefully this video is gonna bring you guys comfort and hope, because I went through the worst of it and I came out on the other side, and now I'm feeling a lot better. So thank you all so much for watching, and don't forget to like, comment, and subscribe. Definitely ask me any questions that you have below. I'll do my best to get back to you, and I will see y'all next time.